joining us. Welcome to the first webinar series on urban-rural linkages in the time of COVID-19. My name is Grace Githiri from UN Habitat, and with me is Remy Siechiping, the Chief of Policy, Legislation and Governance Section at UN Habitat. We also have Camilo Romero, Sunlei, El Char, Herbert Kimani, and Marcio Machado, all ready to support us in any way possible. So during this session, we hope to share experiences from different contexts and geographical regions on COVID response measures in different contexts, and also COVID recovery in the various contexts and geographical regions. So we are hoping to have a great session of interaction and discussions and sharing of experiences in our different contexts. So feel free to share anything at the chat box. You can share your comment, you can share your question or anything at the chat box. It's open. So in the next 75 minutes, we hope we'll have an exciting session, and feel free to share anything that you'd like addressed by the speakers or by any participant that is participating in this session. So for now, I would like to invite Remy Siechiping, who will be giving us introductory remarks, and then we'll proceed with the speakers. Over to you, Remy.
Thank you, Grace. I hope you are all hearing me well and that you are all safe and sound. Again, we would like to welcome you to this important series of discussions that will show the importance of territory as we address this COVID-19. As some of you know, the SDGs is really about leaving no one behind. And we felt that as a urban-rural linkages community, we have to always think that behave and act and support all territories. So leaving no one and no place behind is very, very critical. And those who are left behind or in vulnerable contexts, in rural areas in particular, should not be left behind in the preparation or the treatment or the testing of COVID. So these are some of the things that we feel that when we look at the location of different services and infrastructure, we are a bit concerned that are we actually taking care of everyone? So in this particular webinar, we would like to see how we connect people to places, and that, as you have noted, for the COVID-19, it's a global pandemic, it's a global has a global territorial dimension, but it also has a very, very local manifestation. You're going to hear from the four presentations, four different experiences, going from what countries have been doing at a very, national level, say in the case of Cameroon or Colombia, to the case of a county administration like Songyang, or the case of a city like New York. How are they responding to that? And some of the facets or some of the manifestations that you have already noticed is in the relation to food supply, pricing, in terms of biodiversity and so forth. So nutrition, this is very much at the heart of what we are doing. And this particular forum or space that we are providing to discuss this is in support of various efforts that we have already initiated, and many of you have been part of it, including one of the ways of implementing the Urban-Rural Linkages guiding principles, all the Urban-Rural Linkages toolkits that we have prepared, including the capacity building package, including the International Forum on Urban-Rural Linkages and another space to discuss. We have the regular newsletters that update what is happening. We have also a series of thematic entries that are very critical in this, and we'll be looking at how we also harness the energy in the COVID-19 and see how urban and rural areas are responding to that. So, and some of the series that we are finalizing in relation to biodiversity, for instance, or migration or food systems are really at the core of this response. And this is also very critical to the countries, the 4 countries we are currently operating in terms of piloting some of these ideas in relation to policy implications in Cameroon, in Nigeria, in Tanzania, and in Guinea. So some of these countries will be part of this series to share their experiences. So we very much welcome everyone. We hope that in the next 70 minutes or so, we'll be able to hear more what is happening. In this webinar, it's very much important that it's interactive, so we encourage everyone to keep to 10-minute presentation. We know that some colleagues may need some translation, so we're going to try to facilitate that. But all the presentations will be made available to you so that we don't have to go too much in detail. What is very much useful is the discussion, the exchange that we're going to have. So we're going to start with the contribution from China, the Songyang, or how they have responded earlier on in addressing COVID in rural areas, and it's really at the interface of urban and rural. And so that we can learn from this as the pandemic is emerging in other parts of the country. The presentations will be shown on the screen for those who would like to follow. And I think my colleague Herbert will facilitate that so that my other colleague Lei Song will facilitate or get the mayor to join us very soon. To join. Okay, it's there. So I would like to invite a secretary of the China of CPC in China, Mr. Zhang Wang, to share his experience of dealing with COVID-19 in Songyang County. You have 10 minutes.
大家好，很高兴参加此次网络研讨会，就新冠肺炎疫情时代的城乡联系主题与大家进行交流探讨。
Ladies and gentlemen, hello everyone. It is a great honor to have the opportunity to participate in this webinar.
新冠肺炎疫情来势汹汹，给世界人民生命安全和健康带来了重大威胁。在这场疫情中，中国政府始终把人民生命安全和健康摆在第一位，统筹推进疫情防控和经济社会发展。国内疫情得到有效控制。全国338个有确诊患者分布的城市中，已有316个实现清零。除少数境外输入病例外，国内本土新确诊病例已连续多日控制在个位数。目前，全国上下已全面复工复产，经济社会正在快速恢复。
So as we all know, COVID-19 has posed a public health threat globally. And during the combat against COVID-19, the Chinese government has always prioritized the health and safety of its people, while also planning disease prevention control as well as social and economic development. Besides a few imported cases, the number of domestic new cases of COVID-19 in China have been less than 10 for days. And in Wuhan City, the first epicenter has also declared 0 case of COVID. And nationwide, factories are resuming operations, people are going back to work, and the economy is gradually recovering.
在这场疫情防控战役中，松阳作为一个山区县城，也付出了艰苦卓绝的努力，取得了阶段性成效。
In order to win this war against COVID-19, Songyang, a small county in a mountainous area, has also made tremendous efforts and great achievements.
我们第一时间建立集中高效的指挥体系，确保了抗疫策略的精准有效。在中国政府的集中统一领导下，成立疫情防控指挥部，实行统一领导、统一指挥、统一行动。领导干部深入疫情防控第一线，实现了最快速度救治患者、最快速度控制疫情。 我县唯一一例确诊病例已于2月19日康复出院。
We immediately set up a centralized management system, ensuring the efficiency and accuracy of our actions. And under the leadership of the government, we set up a response unit to lead and command the actions taken against COVID in a unified fashion. Leading government officials have been in the forefront of pandemic control and prevention, resulting in the fast treatment of patients and rapidly gaining control over the spread of COVID. And the only COVID patient in Songyang County recovered and was discharged on the 19th of February.
我们广泛动员各界共同抗疫，形成了强大的社会合力，充分干部的先锋模范作用。医护人员、公安干警、基层干部、社区工作者24小时值守隔离点、交通卡口、社区卡口，广泛发动乡贤、青年志愿者、市民主动参与疫情防控。海外侨胞、社会各界爱心人士积极捐款捐物。我们还派出4名精干医护人员驰援武汉抗疫，为全国抗疫做出了贡献。
We have widely mobilized people from all walks of life to jointly fight against the pandemic. Party members have taken the exemplary role in the organization of medical professionals, law enforcement officers, and community workers to guard quarantine sites, traffic checkpoints, and community checkpoints 24/7. We have also extensively mobilized villagers, youth volunteers, and citizens to actively participate in prevention and control measures. And Chinese abroad and people from all walks of life also actively donated money and resources. We dispatched 4 medical personnel to support the fight against COVID in Wuhan City, and also made positive contributions to the national disease prevention and control.
我们采取科学均准的防控措施，有效控制了疫情蔓延，严格落实早发现、早报告、早隔离、早治疗的防控要求，和集中患者、集中专家、集中资源、集中救治的救治要求，分类实施集中隔离和居家隔离，利用权威发布、公布疫情信息。疫情严控期严格实施全程封闭式管控，推行在家办公，实行远程教学。疫情形势好转后，及时调整转向精密自控，充分利用大数据技术，推出健康码模式作为出行凭证。各卡口严格实施测温加扫码加口罩防控举措。同时，我们采取中西医结合的方式，有效降低了感染率，提高了治愈率。
We adopted scientific and precise prevention and control measures to effectively control the spread of the disease. Songyang has strictly implemented the principles, the principles of early detection, early reporting, isolation, and treatment, and treating the infected in dedicated facilities by senior medical professionals and with all necessary resources. And also implementing home quarantine as well as designated quarantine sites. Updates on COVID-19 are made available to the public every day through our official channels. At the peak of COVID, Songyang County strictly monitored and managed the county closely. People were encouraged to work from home, and students were taking classes online. After the situation got better, we timely adjusted our focus to precise and close monitoring. We are using big data technology, and residents are given a digital health code. Checkpoints are set up to check people's temperatures, scan their health code, and ensure residents are wearing their masks to prevent further infections. We are also using Chinese medicine to boost the immune system and nourish the body. The mixed use of both traditional Chinese medicine and Western medicine is our signature in China's fight against COVID-19.
我们在疫情防控常态化背景下，统筹推进疫情防控和复工复产， 在严格落实疫情防控管控前提下，全县重点企业、重点项目复工率达100%。前除电影院、KTV 等场所外，其他所有公共场所全部有序开放，中小学实现有序复学。同时，我们积极化为危机，推动县域经济转型升级。值得一提的是，今年我们将线下举办了12年的中国茶商大会搬到线上，在更大范围内推广了松阳茶叶品牌，有效促进了茶产业的逆势转型。
We are now working on both COVID prevention and control, as well as promoting social and economic recovery. We have been quite successful on the two fronts. Until mid-March, all of the key county enterprises, key projects resumed operations, and public places have reopened besides cinemas and karaoke bars. And elementary schools and middle schools have also reopened in an orderly manner. We have also turned this crisis into opportunities and promote the transformation of our economy. Songyang held the China Tea Merchants Convention for consecutively 12 years. And this year, we held the convention online. With over 7.2 million views, our brand Songyang Fragment Tea has been promoted greatly, pushing the transformation of our tea industry.
疫情威胁全人类，是全人类共同面对的巨大挑战。团结合作是国际社会战胜疫情的有力武器。我们要加快构建全球联防联控体系，加强各国各区域性国际组织之间的协同联系，共同合作，加快药物、疫苗检测等方面科研攻关，建立区域公共卫生应急联络机制，提高突发公共卫生事件应急响应速度。
This pandemic is a major global public health threat and is a huge challenge facing all mankind. This requires unity and cooperation in the international community. We must strengthen joint prevention and control around the world and work together to accelerate scientific research in medicine, vaccine development and testing, and establish a regional emergency liaison mechanism and fasten the emergency response. And in particular, the coordination and cooperation of regional international organizations need to be improved.
这次疫情也是对各个国家治理能力和治理水平的重大考验。如何加强网络治理能力，提高信息公开透明？如何加强社区管理，构建稳固的基层网络？如何加强政府与社会各界的协同联系？都是疫情背景下提高国家治理能力和水平的努力方向。而中国抗疫的一条成功经验，就是最大限度凝聚政府、社会组织、人民群众各方力量，形成共同抗疫的最大合力。
This pandemic is also a test for governance capacity in various countries. How to strengthen network governance and improve transparency, how to strengthen community management and build a solid grassroots network, how to improve the synergy between the government and all sectors of society. These are all the new issues raised in the context of COVID-19. One lesson from China's fight against COVID-19 is to pull together the strength and resources of government, of the society, of social organizations, and of the people. And this is also an entry point to solve the shortcomings of urban governance in the context of the pandemic.
在这次抗疫中，中西医结合救治的系统方案成为中国抗疫临床治疗的一大特色。全国和湖北省新冠肺炎确诊病例中，中医使用率和有效率都超过90%。中医强调整体观、系统论，以提高人体免疫力为导向，通过辨证施治，有效改善提高人体机能，在治疗疫情方面发挥了独特优势。我们要更加注重中医等传统医学在全球的推广与普及，充分发挥好其在人类健康以及疫情防控方面的重要作用。
Both Chinese medicines and Western medicine have been used in the fight against COVID-19. In both Hubei province and other areas of China, more than 90% of patients were treated with some elements of traditional Chinese medicines. And we see this as an opportunity, and we also see the necessity to promote Chinese medicine globally in the fight against this pandemic.
每场灾难都是成长的洗礼，每次危机中也都孕育着新的生机。在此次疫情中，乡村因其特有的小规模、流动性的社会特点，以及自给自足的经济内循环模式，成为有效阻隔疫情传播的天然空间，展现出新的优势和新的价值。但同时，需要我们更加注重乡村环境整治，加快构建城乡一体的公共卫生体系和公共服务体系。
Every challenge is an opportunity to learn and grow due to the unique small-scale society and also relatively small flow of people and the self-efficient lifestyle of rural areas. We have naturally blocked the spread of the pandemic to some extent, showing our overall advantage and diverse values. But also we need to keep in mind that we need to focus on improving the environment of rural areas.
未来的世界绝对不是单一的城市化世界，而是城市与乡村均衡发展的世界。在这样的视角下，我们要避免城市的无限制扩张，更加注重城市有机更新，加快形成城镇村一体的城乡融合发展体系。要将乡村发展摆在更加突出的位置，更加尊重自然、敬畏自然，积极培育有机农业、农产品加工业、乡村旅游、文化创意、健康养生等多元业态，这才是实现人类良好生存、城乡永续发展生生不息的内生动力。
The future world is definitely not a single urbanized world, but a world in which cities and villages both develop in a balanced manner. So from this perspective, we must avoid the unrestricted expansion of cities and pay more attention to the organic development of cities, accelerate the formation of an integrated urban-rural continuum. We should focus on the development of an integrated urban-rural health system and improve our environment and respect nature. Put more focus on developing a more diverse economy of organic agriculture and agriculture products processing, rural tourism, the creativity industry, health, and such. And this will promote the sustainable development of both urban and rural areas.
女士们、先生们，人类是一个休戚与共的命运共同体。我们坚信，只要全球同舟共济、守望相助，就一定能够战胜疫情，迎来人类发展更加美好的明天。谢谢大家。
Ladies and gentlemen, we are a community of shared destiny, and we firmly believe that as long as the world works together and help each other, we will be able to overcome the pandemic and usher in a better tomorrow. Thank you. Grace, over to you.
Thank you so much, Mr. Wang. We understand it's a national holiday, but you have sacrificed. Again, it's at night. So we really are grateful for creating time to share with us the experience in China and specifically in Songyang. And thank you, Sun Lei, for the good translation. So for now, we cross over to Africa. We will be hearing from Ms. Fuda, who is the head of studies, Planning and Cooperation Division, Ministry of Housing and Urban Development in the Republic of Cameroon. So over to you, Ms. Fuda. Please unmute your mic, Ms. Fuda. Okay, as we wait for Ms. Fuda to sort the connection problem, I would like to invite the third presenter, Mr. Rafael Ferrero, who is an urban policy and metropolitan expert from UN Habitat. So over to you, Rafael, as we sort Ms. Fuda's connection.
Thank you, Grace. Hi, everyone. Good day, and welcome again to this webinar. While I wait for Camilo to start the presentation, thank you, Camilo. Let me thank you to Mr. Wang Jun for its enlightening presentation. Definitely, this case that we just heard about is not compared with the case of Bogota. They are not compared neither in numbers and figures nor in impact of the virus in the city. But I think this case that I will show you after is a good example on how Latin American cities are addressing the pandemic. So I will show you the mitigation measures from Bogota, the capital of Colombia, but also I will show you some measures that the city is thinking to have at the middle and the long term. Thinking also in a post-pandemic context or post-pandemic situation. So let me start to give you some context, some quick context about Bogota. So here you can see, I hope that all of you are seeing the presentation. Here you can see first the location of Bogota within the country. As I said before, Bogota is the capital of the country. At your left, you can see the map of Colombia, and at the center, the region, the Bogota region, which is composed not only by the city of Bogota, but also by 4 departments. The department here in Colombia is the second, the intermediate government level between the nation and the cities. So the central region of Colombia is composed by Bogota, but also for another 4 departments. This is important to see the location of Bogota within the country, because Bogota is located at the center, physically at the center of Colombia. It is not at the coast, and this is related with the flows of people, of goods coming to the city. After I will show you more this relation between the city and the region, and how the city and the region together are working to addressing this pandemic context and this pandemic situation. But for now, I want to give you also some context about the land uses in Bogota and the rural and urban lands, because as you can see in the map of the middle also, mostly of the land in Bogota is rural. However, only 0.2% of the population lives in these rural areas. Bogota has a population of 9 million people approximately, and the city produces the 30% of the Colombian GDP, and accounts for the 20% of the Colombian population. You can see in the map the gray areas is the urban land. The urban land represents the 23% of all the total land of the city. And between the rural, which multiple uses mostly agricultural, and the protected soil accounts for almost the 75-76% of the land of Bogota. And also Bogota has approximately 2% of the land in urban expansion dynamics, new urban developments and new urban settlements. So with this context, let me to show you first the measures that the city is taking to address the pandemic. I think we are having a problem, technical problem, but let me show you from my PC the presentation. I will. Camilo, if you want, I can share from my PC. Don't worry. Let me share from my PC. Okay. So I want you to give also some numbers on the COVID-19 impact here in the city. Until the last Friday, May 1st, we have almost 3,000 confirmed cases, from which we have 200 people at hospitals, almost 50 people in urgencies or intensive care units, and also we have almost 700 recovered cases, and we have a total deaths of approximately 110 10 people. Let me say that this is approximately the 35 or 40% of the country's total cases. So this is a representative number, but I would like to highlight that in the rural Bogota, in the rural areas of Bogota, we have until now zero cases, both as confirmed cases, but also in deaths. We have zero cases, and hopefully we will maintain this situation. I think that for understand this figure is very important, that our colleague from China show us before, and that rural areas are some have some kind of protections, because the lower numbers of flow, both in people but also in goods. So this is the numbers in Bogota, and I would like to show you also the principal strategies that the local government is implementing for addressing this situation. And the mayor office have implemented a program which is called Bogota Solidarity at Home, or for Spanish natives, Bogota Solidaria en Casa, which means that all people have to stay at home, but the city government and also the national government will provide those people with some help. And I listed there in the presentation the two kind of principal help and support that the local government is doing for rural people included, because local government have implemented several kind of helps and support, but only two of this solution are addressed also to rural people. So for instance, the local government is transferring some cash or money help to families or to homes. Until the last Friday, we have almost 400,000 families supported by local government. Within them, we have almost 200 rural families supported, which accounts for 0.05 of the total cash transfers. And also the local government is supported through food markets, food vouchers, and hot food to the families and to the homes with lower economical and social conditions. And until now, the local government has supported almost 3 million of this kind of help, and almost 9 or 8,500 directed to rural population and to rural family, which accounts for almost 0.3%. This figure seems low, seems quite small, but if you remember, from our last slide, rural population in Bogota is 0.2% of the total of city's population. So in statistical terms, 0.3 and 0.05 is almost representative for the total population and the total support and help that the city is providing to the citizens. But also, let me say that the situation in Bogota, as I mentioned it before, is not has not the same impact that has in other parts of the world. For instance, in terms of food supply, the city is totally covered, and there have not yet some impacts in the chain supply, at least related to food. For instance, some figures. Let me give you only two examples of this. Almost 50,000 of cargo vehicles with hoof have entered to Bogota in the last month. Please take into account that this is in Bogota. This is the seventh week in quarantine. We are waiting. We don't know yet, but we are waiting if at the end of the city the quarantine will be extended or will be finished. For now, that I will say is that probably the quarantine will be extended, but there is not an official communication, an official decision about it. We are waiting for that. But in the last month, in the last 6 weeks, the food supply was totally covered. Almost or approximately 321,000 tons of food have entered to the main market of the square, the main market square of the city, and from there to the others local and neighborhood markets. And also this is very important because the local government have started small programs to support small farmers and small producers. For instance, 700 farmers from small producers organizations are being beneficiaries of the pilot project or a pilot plan called the Mobile Markets Pilot Project, which consists to take the market, the productions from the farmer to transport them to the city and to the main market square of the city, and from there to the others local market squares. But also there is another program which is about train local producers, local farmers which live in rural areas, and until now more than 500 farmers have been trained through this program. And the principal objective of this program is to enhance, to improve the productive skills from these farmers, of course, in the COVID-19 situation. These are some of the programs and of the solutions that the local government is implementing in this mitigation phase. But also the local government is thinking about a middle-term recovery strategy, and this is very important because here in Colombia last January new mayors took office. We have this year new mayors for a mandate of 4 years from 2020 to 2024, and they are designing, they are in the approval process of their local development plans. And of course, some of them are taking this opportunity and taking advantage to include some recovery strategy within their plan. For instance, this is the case of Bogota. Bogota is formulating the new local development plan, and the mayor office have taken the opportunity to include some of the mitigation measures to continue to implementing them at the middle term. For instance, they have include some healthcare measures, but also some economic support measures. They have include a new program within the new development plan, which is called like a guarantee minimum salary to provide more subsidies and contributions to meet the emergency to the low income families. And also they hope and they expect to continue implementing the Bogotá Solidarity program that I explained before. Also, they are including some mitigation measures from economic and environmental perspective, but they are highlighting on economic promotion, economic impact, and economic reactivation. They are including a program within the development plan, which is called economic reactivation program. And also they will include other complementary measures like smart and sustainable supply systems, urban and peri-urban agriculture, and so on. And see this figure because this is important. Approximately 1.6 of the budget was adjusted due to the pandemic. This means that all the investment plan that the city is taking for the next 4 years is being adjusted because the pandemic. And for now, almost the 2% of the investment plan for the next 4 years. But also, I mentioned you before at the beginning of the presentation, the relation between Bogota and the central region of the country. And for that, Bogota is thinking to boost the implementation of one public policy that was adopted in 2007, which is the Rural Development Public Policy. But taking this situation into account, the city government is taking to boost this policy and to include and to implementing quickly some programs and some projects related to food and water security, also related with productivity, technological reconversion, and improvement of sanitary conditions from rural producers, from farmers, but also is taking to protect strategic ecosystems and environmental management of protected rural land in a very similar way that our colleague from China mentioned it before. And also to finish with this is the last policy that I would like to highlight today. This is the Regional Food Supply Plan, which is currently being adopted, and this will be a mandate from almost 10 years until 2013, and the local and the regional government are collaborating to implement jointly some strategies, for instance, for consolidate an efficient, sustainable, and healthy supply system, but also to improvement rural productivity, both in the city, in the capital city, but also in the central region of the country. And this is important because almost the 50% of almost the middle of the goods of the food supply chain depends of this region, of the central region of the country. So both government, regional and local, are working together to implement this regional plan, this regional food supply plan, and of course they are taking into improve some of the programs and of the projects included in the plan due to the pandemic situation and the COVID-19 impact. So I think that's all that I want to show you today. Of course, let me highlight again that this is not compared with China or with United States cases, but I think this is a good example on how Latin American cities are thinking to address the COVID-19 situation, and thinking not only in small term measures and in mitigation measures, but also thinking on having middle-term and long-term recovery strategy. So thank you, and I hope to ask the questions that you could have later. Over to you, Grace.
Thank you so much, Rafa. Um, because of time, I think we'll just proceed to Thomas Foster, who will be sharing with us. He's the director of practice to policy to practice, and he is sharing with us the experience from the United States of America. I know most of us know him, especially those who have participated in the development of the guiding principles of urban-rural linkages. So over to you, Thomas Foster.
Thank you so much, and I will try to keep my remarks very brief. Let me show my video. There we go. And oh good, you see now the slides. I'm going to be speaking about New York City and the context of the work here on connecting urban and rural communities from crisis to convergence. As Rafael has mentioned, his situation in Bogota is so different from China. So too, the situation in New York is extremely different from both Latin America and China. I'm very sorry we haven't heard from Ana Fuda from Africa, and I hope we can in future opportunities to look at different regions. So the main message here is that the convergence to the crisis here is leading to convergences. I'm not going to be able to read the slides for time here, but I'm going to start by saying that the New York City urban food system before COVID is important to understand what's going on right now. The market system for food supply, 19 billion pounds a year, through a very fragmented distribution system with thousands of distributors. 95% of the food enters New York City by truck. The largest wholesale market, though, only feeds 15% of the city, and we have 42,000 different kinds of outlets, from grocery stores to bodegas and restaurants. We also have the largest farmers market system. So that is really quite separate from the social protection or humanitarian and emergency food system, which before COVID, again, 1.2 million out of the 8.3 million, or 1 out of 5 residents were classified by the national government as food insecure. And New York has had a longstanding system of supplying food to children and families in this population through soup kitchens, free schools, meals, and a combined federal or national, state, and city food safety net. And this two-part system actually is changing right in the midst of COVID now. It's only been 7 weeks, but there have been very dramatic changes. And the extraordinary numbers in New York City are just making these changes absolutely necessary. There are 160,000 confirmed cases, 18,000, these are rough numbers, deaths as of this weekend. This is almost 30% of the deaths in the US, so this is definitely the hotspot, and not only in the US. So we had in the first weeks 20,000 restaurants closing. Only about a quarter of those have reopened to convert to takeout. So the future restaurant industry is very uncertain in this city. There are 4 categories that the city targeted: COVID vulnerable, previously food insecure, the COVID vulnerable and food insecure, and those who, because of disabilities and age, have to be delivered at home. So the taxis, who are all out of work, have been recommissioned to supply meals to homes. There's a distribution system that has been stood up that is shifting the supply from restaurants to stores and home delivery at a scale never before seen. Because of school closures, there are 450 meal hubs serving 500,000 meals a day now. That could go up to 1 million meals a day. Yesterday, the mayor of New York said the capacity is there to grow that to 1 million meals a day. And the private sector has adjusted the supply to food chain vulnerability dramatically. I don't have the time to go into details. If we go to the next slide, I can't make the slides work. So please shift. There we go. So if you look at nyc.gov/getfood and the Feeding New York City plan was launched 2 weeks ago today. This is what you would see is a map of the 450 hubs, which you can drill down to find the meal hub nearest to you. Also, there's a call for volunteers and delivery service assistance. And as I mentioned, there are thousands of people using scooters, and the solidarity that has risen in New York is phenomenal. But the city government has internally built a never-seen-before multi-agency collaboration across many agencies, starting with medical supplies and managing the shutdown of the city, but also for food access. Let's go to the next slide, please. And but the regional food system has started to become more and more important because the supply of the city coming through long supply chains is really at risk. You might have seen the media coverage of the virus in meatpacking plants, in industrial meatpacking plants in the Midwest and far west of the US. So there are many reasons why, and before COVID, the regional food system had already begun to be more important for climate resilience and economic development reasons. But now in a post-COVID anticipation, there is a lot of new redirected funding for regional farmers. There are limits in the regional farm. There are 100,000 farmers within 6 hours drive of New York, but there are many capacity, infrastructure, and market access issues that are actually very similar to other parts of the world where smallholder farmers cannot access their local markets, and the national policy doesn't support that. This is the same thing in the US, although we're thinking post-COVID, this may change. And the last slide, please. So in the region of New York, within these two boundaries are the 3-hour drive shed, as the planners call it, and the 6-hour drive shed. There is a again, I won't go into the details, but there are 4 areas of policy and investment support that have been pulled together through this multi-agency collaboration on the level of governance, distribution and infrastructure, support for the small and medium scale or family farmers through the city funding. There's $170 million being put towards just the food plan in the next 4 months, of which about 30% is for regional agriculture, much higher percentage than in the past. And finally, the policy and investment in short chains is increasing, as I just mentioned. So the collaboration across these market and social protection systems is underway for the first time in history, and there is evidence of new levels of efficiency and advantages for feeding all New Yorkers, low income and medium and high income, and integrating access and supply, which have been previously held in separate departments and agencies. So that's the conclusion that I'd like to give is actually that many of the principles and the actions that a number of us worked on for the last 2 years on the urban-rural linkages and guiding principles are actually being applied at a very large scale in New York City and the region. And as the COVID crisis turns to COVID recovery, we will just see how much of this convergence is institutionalized. That's a story yet to be told. So with that, I thank you, and I'll turn it back to you, Grace.
Thank you so much, Thomas. It seems we'll not be able to have Ms. Freda from Cameroon, but we will be sharing the presentation with all of us after this. So for now, we will proceed to discussants, and I'm handing over to Camilo Romero, who will be taking us through the next session. Over to you, Camilo.
Thank you, Grace. So now we are going to start with the questions and answers section. So we are going to start with some questions that the audience have posted for our presenter from Colombia, Rafael Forero. Rafael, could you please help us clarifying which ones are the measures that are being taken in Bogota in order to contain the transferring of the COVID-19 pandemic into the rural areas? Is there any measure that the local government has taken to control, let's say, this geography of dispersion?
Yes, thank you, Camilo. Let me say before that the geographical distribution of the city of Bogota aims to take the pandemic controlled from urban to rural areas. Let me explain why. Because rural areas of Bogota, as you see in the map that I showed you before, are located almost in the south of the city. There are almost 10 or 15 kilometers between the rural center of the urban center of the city and the rural population. We have almost this 70% of the rural population located 10 or 15 kilometers away from the urban center. But also, as I said before, all the city is quarantined. So of course that flows and travels from rural to urban territory and vice versa are forbidden. And this is the situation from 6 weeks ago, and we, as I said, we don't know yet, but we hope to have these situations for at least 2 or 3 weeks more. So I think that the geographical distribution of the city have helped to contain this COVID-19 spread to the rural areas, and this is very interesting to see in Latin American cities, because I think that Latin American cities are segregated geographically, and there are, for at least in Colombia, there are big distances between rural and urban centers within the cities.
Thank you, Rafael, for your answer. Now we have our fourth speaker, Ms. Anna Foda from Cameroon. She's going to present the case of Cameroon. So over to you, Ms. Foda. Ms. Anna Foda, we cannot hear you. Could you please unmute your microphone? Okay, so I think we're having a problem with our first speaker. She cannot connect. So we are going to proceed to the session of questions and answers. So we have a question for our first speaker. Mr. Wunjan. So the question is, if in the district of Songjiang are considered to balance and restore and or to manage the natural environment, in other words, biodiversity and wildlife in the urban-rural continuum. So please, Mr. Wunjan.
We pay great attention to the protection of rural environment. During our agriculture process, we have limited the use of artificial pesticides. And we have banned the killing of wildlife. We are also implementing classification, waste classification. We also have strict standards. So higher government overseeing they facing the budget and sure. Back to you, Camilo.
Lei, can you hear me? We cannot hear what Mr. Junwan said about that question. Could you repeat him? We try again.
My apologies. Is my microphone working right now?
Yes, yes. Now we can
I'm
hear
so
you
sorry.
loud and clear. Yeah, please go ahead.
So Mr. Wang Jin was introducing that Sonyang has paid great attention to environmental protection, and they have banned the killing of wildlife, and they are also developing organic agriculture. And for the agriculture process, they have banned the use of harmful pesticides, and they also have strict standards for air quality and quality of the river in Sonyang. And he was also telling us that the budget that Sonyang receives every year from the supervising higher government is closely depends on their performance, and one of the major criteria for their performance is their actions on environmental protection. Over to you, Camilo.
Thank you very much, Lei. So now we are going to give the floor to Mr. Karim to make some comments about the presentations, today's presentation. So you have the floor.
Thank you very much. Can you hear me?
Yes, we can hear you loud and clear. Please go ahead.
Yeah, that's good. I'm based in Ghana, so sometimes the internet is working well and sometimes it's not working well. Thank you very much for inviting me to comment and to listen in to the presentations made at this meeting today. Having been in Songyang, it was particularly at the meeting, the IFL last year, it was particularly interesting to hear the presentation from Songyang, and great to hear some more about the reality of the crisis and the way it's been dealt with in this period. Also, the elements from Bogota were very interesting. Now, sitting in Ghana, I'm keen to maybe share a couple of points about how the crisis is being handled here, with a period of lockdown, but then now an opening up of the economy, maybe much quicker than in some areas, to allow people to continue with their livelihoods and their incomes. Now, at the same time, though, there are strict controls on traffic across borders and so on, and many changes being made in value chains and the way in which produce can move across the country. The importance of moving away from, or evolving from the containment measures, which were very strict, to a kind of controlled opening, which allows for movement of goods and some restart of livelihood activities and economic activities. The importance of doing that was made very clear because of the rapid slowing of growth in the country, and the need for increasing borrowing, the reduction of trade opportunities. So Ghana really did act fast to try and contain the pandemic. Unlike some of the other regions that we've been listening to, there are very few, relatively few cases at the moment. But at the same time, had a lockdown, had a border closure, and is now supporting a gradual easing up of regulations to allow livelihoods to continue within the country in order to avoid a collapse of growth and of food systems. Now, this brings to mind that in the poorer countries, which maybe cannot provide the same levels of support as to the economy and to poorer actors within the economy and to agriculture in particular, it's important to have this balanced approach while being very careful not to allow the spread, or to deal with the spread and deal with the health issues, at the same time to be concerned to maintain borders open for trade, maybe not, and then a gradual approach to movement of people, in order to maintain confidence and investment in the key economic sectors. Now, this brings to mind
Karim, seems to be that we lost you, but thank you very much for sharing the experience and the situation that you are currently facing in Ghana. So now we are going to continue with questions from the audience for our speakers. So we are going to continue with our speaker, Rafael Ferrero, who exposed and tell us the experience in Bogota, Colombia. And he would like to tell us more about the
food markets, I think, Camilo.
Yes,
Let me to reply a couple of questions about the food markets management here in the city. I think Marta Landi and also Rosana have questions about this. Let me to say that here in Bogota we have two kinds of food markets. We have the principal market square, and also we have several local squares and local markets distributed by localities. So in the principal food markets, the local government has taken three principal measures to avoid the spread of the pandemic. The first one is to block the direct sales for a couple of days when the pandemic before starts to be hiding here in the city, and also when quarantine started, the local government blocked the direct sales from the principal markets for a couple of days in order to plan better the way to go on with the sales. Then they have reconfigured all the cell systems, and for instance they have distributed the cells among the day, classifying different sectors of the market by hours. So by some hours cells are available in some sectors of the markets, and so on. And third, they avoid sales in rush hours. Sales in rush hours are not allowed. So these are the three principal measures from the principal square. But from local markets are forbidden all the sales, and all the local markets are working by phone. Only in the last week this kind of measure is being replanned again in order to allow some people in some hours to access to these local markets, but mostly of the sales from the local markets are being by phone. So these are some kind of measures that the local government is taking to the food markets. Over to you.
Thank you, Rafael. So now we're going to continue with another question that was posted in the chat box. And I would like to give the floor to our speaker, Thomas Forster, if you want to address this issue with the food markets in the context of New York.
Thank you. Sure. Yes, Camilo. And in fact, the measures that Rafael just reviewed for Bogota are very similar. There was quite a struggle in the first weeks to keep the farmers markets open. As I mentioned, there are 60 markets that are open air markets across New York City, and actually quite a few more that are not in the public market system, but private markets and street markets. So the markets were kept open after instituting the reconfiguration, like Bogota, so that there was a lot more space used, and this required extending the permitting for markets in New York City. They're very important in a city which is otherwise shut down as a form of solidarity between urban and rural actors. There was a question also about the cross-contamination or infection from urban to rural, which actually has not been a real issue, not so much because of a prohibition of movement, but because of the character of the movement in trucks and the distancing in warehousing, where the exception is the processing sector. In especially the meat processing sector, we have had very poor practices of social distancing, and the infection rates have been very high, affecting and closing down many packing plants in the U.S. But in terms of the regional food system, the farmers markets are very important. And also, as Rafael suggested or said about for Bogota, many of the farmers have joined to provide not only online ordering, but home delivery services with neighborhood volunteers related to community-supported agriculture schemes that have existed also in New York. So there's a lot of creativity right now going with connecting food from the region with the city. Back to you.
Thank you very much, Thomas, for sharing this information on the food markets in New York City. We have also in the chat some interesting discussion about the role of digitalization and e-commerce and how this is can connect producers and consumers in this time in urban and rural areas and keep moving agricultural and value chains. Yeah, so just with this comment from our chat box, I would like to give the floor to Remy, that we are approaching now to the end of this session today, and he will provide us with a few conclusions about this. So I will pass on to you, Remy. Thank you very much.
Okay, thanks a lot, Camilo. Thanks everyone for staying on, for participating and contributing. This has been a good trial. We know that in terms of technology, we had some challenges, but there were very much a good inside discussions and things that we have learned from the 3 cases that were presented in Latin America, in North America, and in China. So I think this is a good start. We're going to sharpen the next one. So the announcement, Camilo, confirm, is it tomorrow or on the 14th? The next webinar?
Yes, the next session will probably take place on the 14th of May. Yeah,
13th.
So we will let you know soon.
14th. Okay, so we're going to be 14th of May. We're going to try to improve the technology. We're going to try to get your feedback on what worked, what didn't work. But looking from the bright side of the discussion, we felt that this had been a good way of learning, a good way to draw lessons and ideas from different places to see how we could work better in the context of urban-rural linkages and the local context that we need to advance. We're going to hear more of the global responses, some different scale of interventions and lessons, and we're going to keep this conversation going. Again, thank you very much for your active contribution, and to the presenters for taking the time, effort to organize this, to provide very rich presentation. And for my colleagues, Camilo, for coordinating all this effort, Grace, Leah, Thomas, and Florence, everyone who had, and of course, Herbert for the effort behind the scene. But again, this has been very helpful. We hope we're going to keep the conversation and keep you on the list of all the information that is happening on the urban-rural linkages. So again, thank you very much and stay safe.
Thank you. Thank you all.
Thank you all.
Bye-bye.
Bye, everyone.
Bye-bye. Thank you.
Bye.
Bye-bye, Grace.
Bye.
Yeah, it's Abdul from Mina.
Oh, bye-bye, Dr. Abdul.
Thank you very much. My regard to everybody. Bye-bye. Yeah.
All right, bye.
Yeah.
Hi, Herbert. Please, can you just loop me in with Grace? Perhaps we can discuss for some minutes.
Hi, Emmanuel. I can call you.
Okay.